Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing plastic surgery in the Scottsdale Paradise Valley area since 1992, and all I perform is aesthetic or cosmetic plastic surgery. I perform tons of rhinoplasties, one of my favorite procedures, and a common question that I get is, what is a rhinoplasty with a septoplasty? Well, most people know what a rhinoplasty is. That's a nose job, and that's where I'm actually creating a more aesthetic, functional nose, and that is, where you and I go through photographs and we kind of figure out what we want to do, and you bring in photos of noses you like, I image your photos preoperatively, and we go from there. A septoplasty in my rhinoplasty patients is almost always part of the rhinoplasty. A septoplasty, plasty meaning the change of, is changing the septum, which is the cartilage that is on the inside of the nose. If you put your finger in your nose, and don't have anybody see you do this, but if you put your finger inside your nose, you can feel like a septum that separates the nostrils. That is the cartilaginous septum. In most people, there is some deviation of that. Whether or not it causes problems breathing is one thing, but that septum is there because it separates both nostrils. Almost always that septum is a little bit off, and as part of my rhinoplasty, I usually do a septoplasty for a couple reasons. One is that if you think about building a house and the rhinoplasty being the way that the house looks, we want to make sure that the foundation of that house is completely centered and completely midline, because that is what supports the nose. So almost always I will do a septoplasty to put that septum in the midline. That serves a couple of other purposes. One is it helps you breathe better, and two, it provides a source of cartilage grafts that I generally use for your rhinoplasty. Almost always I will take a piece of that septum from the septoplasty and put it down in the center of the nose to provide support, almost like a stake in the middle of your nose, so that I can keep all the structures that I now put where I want in the midline in position. Oftentimes I will take other pieces of cartilage from that septoplasty and provide tip grafts or things called spreader grafts that can help you breathe better. But all in all, a septoplasty can be a separate procedure in people that have difficulty breathing with a deviated septum, or part of a rhinoplasty, which it usually is part of my rhinoplasties. The trade-off is a very rare complication could be a small hole in the septal mucosa, and that could be a problem because it causes whistling when you breathe at night. I've almost never seen that. That's about the only real trade-off in the septoplasty. But all in all, I think a septoplasty is an important part generally of a rhinoplasty. It helps me give you a longer lasting, more predictable result, and generally helps you breathe better. So the best way to understand is, if you're considering a rhinoplasty or a septoplasty, come in for a consultation. It's really one of the fun part of my practices, and it's a really fun process. Thank you.